have a guest who's coming on to talk to us about healthcare premiums, which we know has been a huge topic across the country, but particularly here in Hampton Roads as well. We have parents, seniors, families, small businesses. A lot of people have been struggling to keep up with those health insurance costs. Even as the monthly premiums have gone up, people are still facing high copays, surprise bills, denied claims. And so there's a lot of conversation right now for people on how they can afford these costs. And with more on this and why these healthcare costs are so high, we welcome former health insurance executive and president of the Center for Health and Democracy, Mr. Wendell Potter, who joins us right now. Wendell, can you hear me?
I sure can. Can you hear me? And thanks for having me on.
I can hear you, and thank you for coming on to the show. We certainly appreciate it for a very important topic here that's on a lot of people's minds. Okay, I got to ask you this first question first, right? Why are families paying more each year when we're talking about premiums and deductibles and copays for health insurance in general? What has driven the high cost for the average day American when it comes to their health care?
When two words, corporate greed, and it's because of the way health insurance companies have changed over the years. I used to be a healthcare executive. I was an executive of Humana and Cigna for 20 years. The companies have become massive corporations, and most of them are traded on the New York Stock Exchange. First and foremost, they have to satisfy the profit expectations of those shareholders and a handful of Wall Street financial analysts. And to do that, they have to deny more claims. They have to make us pay more money out of our own pockets for care, even as the cost of a health insurance policy gets more and more and more expensive, and restrict our access to doctors and hospitals. These are barriers they've set up just so they can enrich their shareholders. And all of us are paying dearly for this out of our own pockets. The family policy these days cost about $27,000 on average. That's the price of a car. And even with that, the value of our insurance policies goes down every single year. So it's high time that Congress does something about this. This is a historic week because members of Congress are hauling in the CEOs of five big insurance companies for congressional hearings, and they're going to be in the hot seat.
And I got to ask you this. You said it's time for Congress to do something. I'll get some other questions. I'm just going off of that first. What can Congress do, in your estimation, in order to address the issues that you're citing?
Two or three things. There have been some members, actually on both sides of the aisle, who've called for the breakup of these companies. They have become giants. United Healthcare is owned by a corporation that is the third largest company in America by revenue. United Health Group operates a big health plan, but it's also gotten increasingly into healthcare delivery. It's the biggest employer of doctors in this country. My team and I did a research project that we found that that company alone has 2,700 subsidiaries. It's just enormous. The company that owns the Aetna health plans, CVS Health, owns all the 9,000 retail stores and a big pharmacy outfit that sucks so much money as a middleman out of the pharmacy supply chain. So that's one thing I would like to see more attention focused on. How can these companies continue to be this way? Why aren't they being held to the same standards that banks are held to, for example, that cannot engage in some of these self-dealing practices that these companies are doing with? There are other reforms that there is bipartisan interest and support for, but there's a lot of work that members of Congress must address.
And for everyday people who are paying, these costs and they are feeling the pinch every time that they're dealing with anything with healthcare, what would you say to them? What can, in your estimation, that the everyday American can do as they're trying to figure this out on their own?
Two or three things. One is to be a squeaky wheel. If you are ever denied coverage for something that your doctor says you need, uh, appeal that denial. Don't take that as the final answer because insurers know that a lot of people don't appeal. They don't fight back, but fight back if you're being denied something. Number two, if you get your coverage through an employer, complain. complained about the cost of health coverage and about your lack of choice. Very few people have much choice to choose a health insurance company. Complain about all that you have to pay out of pocket before your coverage kicks in, and let your members of Congress know about your experience and how unhappy you are. They need to hear from their constituents. Many of them already are. Some of them are doctors and pharmacists, and I've talked to many of them on both sides of the aisle. They're beginning to understand more and more how these corporations have taken over our healthcare system and why that's not a good thing. But they need to hear from their constituents.
Well, like I said, we appreciate you coming on because there are a lot of people who certainly have questions when it comes to their healthcare and concerns. And when we talk about those prices, it's something that we've repeatedly talked about, Wendell, here, particularly when you had the ACA enhanced subsidies and a lot of people affected with that here in Hampton Roads. But we appreciate you breaking that down.
Sure.
Just one last question before I let you go. Where can people go to get more information from you and then the group that you are with?
I lead an organization called the Center for Health and Democracy. You can find us there. And a newsletter that we publish is called Healthcare Uncovered. It's published on the Substack platform. It's free, no charge at all. So look us up in both of those places.
Okay, that is Wendell Potter, the president of the Center for Health and Democracy. Wendell, thank you so much for joining us this morning. We'll have to have you back at some point.
I'd like that. Thank you very much.